Hi, I'm Dr. Ashley Fuller.
And I'm Dr. Meredith McClure.
And this is Labia Logic,
the podcast that's all vulva, no filter.
We're here to talk about all the stuff your doctor rushed through, the questions you've been too embarrassed to ask, and the sex ed that barely mentioned the vulva.
Because too many people are suffering in silence with painful sex, menopause misery, and vulvar issues no one talks about.
No shame, no stigma, just real talk, real answers, and the education you should have gotten in the first place.
Welcome back to Labia Logic. I'm Dr. Meredith McClure.
I'm Dr. Ashley Fuller. We're excited you're here.
Yeah, so we're talking today about itch, and our title is called Can't Stop, Won't Stop, Labia on Fire. Let's talk about itch.
Let's talk about itch, because I feel like people are like, oh yeah, labia itches, the vulva itches, but it is like something that can actually really affect your quality of life. I mean, it can be severe.
Absolutely.
Just feeling like you have to scratch, or you can't sit, or you can't be on an airplane for a long time, or whatever. I mean, when this area of your body itches, it can be so frustrating and disturbing and distracting.
Yeah. And we'll talk about how disruptive it can be to your just everyday life. And it can really consume a lot of your time, really, when you have some of these skin disorders that cause you to itch and scratch and you can't stop.
One of the things that happens, I always tell my patients, is that because of the type of skin that's down here, it has a lot of blood flow to it. And so once we scratch it, it actually gets more itchy because it gets more blood flow to it. And then that makes it gets kind of swollen. And then that makes it itchy, but also it releases some immunologic properties called cytokines that also make inflammation. Inflammation's warm, hot. When we think about almost like an infection, although not all itching is an infection, but it's kind of warm and hot and it tends to itch. And so, we get into this kind of itch scratch cycle, I tell patients, where it itches, so we scratch it, and then it itches more. And sometimes it is so hard to break that cycle.
Yep, absolutely. And I think when we talk about itch versus scratch, the itch is the symptom that you're having, that feeling, and the scratching is the action. So there's a difference between the two.
Thank you. Sometimes as I say it, I get a little confused about, but yes.
I know,
so the sensation, scratch is the action.
So if it is itching normal,
anywhere in your body, you can have an itch, right? Yeah. It's a nerve sensation. So I would say, yes. I mean, I think everyone who has a vulva has had an itch there before, just like anywhere in your skin. I think it can become abnormal if it's a persistent itch that won't stop. And that's where we come in.
Yeah. And I think I always, try to think of things in the vulva, because the vulva is so complex and you have to kind of simplify things. And I would put itch into a few buckets. There's skin problems that can happen. And then, of course, even a level deeper with muscles, and then even infections can happen down here. I think so many people think an itch is going to be an infection every time, but it's not necessarily that. And we really have to dig in. And my patients look at me like I'm crazy sometimes because I'll start asking them about products they use and things like that. And they're like, aren't you the period doctor? I'm like, no, I'm like, hold on, wait a second. I'm putting on my dermatologist hat. Just look at me like a dermatologist now.
Yeah, right. Well, and so often too, I see patients who have had itch for a while and they call their other physician and they're just prescribed an antifungal just automatically.
All the
because
time.
If you itch down there, it must be yeast infection.
Every time. It's got to be yeast.
It's got to be.
Which is not true.
It's not true. Really not true. And if you have an itchy vulva, you should have someone look at it and do some tests. Don't just take an antifungal without knowing. I mean, I'm sure we'll have another episode just about yeast and things like that. But I mean, yes, yeast infections absolutely can cause itch. It's one of the big things, and we'll talk about that too. But it's not always that. And to assume it's that without an exam is not fair to you as a patient. Now, of course, there's, times where it's Friday afternoon and you're about to go on a trip. I don't think it's dangerous to necessarily take an antifungal, but definitely we see more yeast infections that are becoming resistant to antifungals. So I usually try to be sure patients have a yeast infection before I treat them. And an exam tells us so much.
Yeah. And I think when we're looking at vulvas and talking about symptoms in itch specifically, it's also important to think of the whole body. I mean, sometimes an itchy part on your vulva, you should actually look at other parts of their body. And I ask them, like, do you itch anywhere else on your body? Are you someone who has allergies? Are you an eczema type person? Because that can even kind of clue us in to possibly some leads on why you're having itch in your vulva.
Yes. Then I agree. I always kind of put my dermatologist hat on and ask them, well, what are you doing down there? Like, what is happening? So you are you using what kind of detergent are you using on your clothes? What kind of underwear are you wearing? Does it only happen right after your period? Like what kind of pads or tampons are you using? Like I'm looking at what is touching this skin that could be causing this itch.
Just like on our episode about hair care, what are you doing for hair care down there? Maybe you're using an old razor and you're having irritation from that. Or maybe you went and had a new fun way of getting your hair taken off, whatever way we do that. And maybe there's something in the wax or in the material that they're using that you had a reaction to.
Maybe you decided that you're going to use baby wipes or
Ugh.
wipes to clean this area because you didn't feel like it was clean enough. Those often have chemicals in them.
Yeah.
Generally don't recommend them.
So many just use them after you've you go poop, like, and they say, "Oh, just use it on the backside." Well, those chemicals get on your hands, and then
Yeah.
they transfer to the vulva. So if you do need wipes, and you're someone who likes using them, there are wipes that just have water in them,
Yes. The
and
water wipes.
those are what we would prefer you use. And even if it says sensitive skin, it's not meant for your vulva.
I'm team bidet, if you have to say.
Love that.
Bidets are amazing, especially if you get one of the really nice ones. They totally change anal care, but I also think that can definitely affect the vulva too. Especially some of our patients that have vulvar dermatologic conditions that can also affect the anus. So it's kind of a tangent, but I do think bidets can be great, and wipes tend to be not awesome. Um, Also, if you're leaking, urine, that can make a difference. If you're, going to the gym and sweating, like there's all these things that can just touch and irritate the vulva. And so
Yeah.
sometimes we're playing a little bit of dermatologic detective of like, wait, when is it happening? How often is it happening? What are you doing right before it happens? Those kind of things.
Mhm. And then sometimes we get really in a bind and we can't figure it out, and we're trying many different things and it just keeps coming back. And there is something that it's specific to dermatologists that do this. It is not allergists or immunologists. It's called patch testing. You want to talk about that?
Yeah, so patch testing is when they'll take a bunch of different allergens and put them on a place on your skin, usually your back, and kind of look and see if you have a reaction to them. So looking to see if your body's having, some kind of, histamine or, immunologic reaction that's causing cytokine production. I'm saying a lot of big words to say inflammation. Do you get
Mhm.
hives or some kind of irritation there from these? These can be really helpful because it sometimes identifies something that you're using on a regular basis is actually causing some of this itch.
Yeah. The things that you might have no clue. Like it could be something in a shampoo or something that's on your toilet paper that you had no idea, because there are a lot of chemicals that they put in these products that we don't even necessarily know that are irritating to us. And so you'll know which ones to avoid.
And I will say too that, when we talk about the vagina, we do talk about the vagina being a self-clean organ. You don't need to put anything inside the vagina to clean it. You don't need to douche, those kind of things. The way I recommend my patients clean their vulva is just with water.
Mhm.
So water in the
Yep.
shower, putting your fingers in between the labia minora to kind of clean out any dead skin cells that tend to accumulate there in these folds. If you want to use something that like a soap on the hair bearing areas, the labia majora, you can, but you definitely do not need soap in the labia minora, in the inner labia.
There definitely are, moving from allergy type skin reactions, what we would call allergens or irritants, which is things that are like in various chemicals and things like that, where we can actually have actual skin problems that can happen all over the body, but also in the vulva specifically. And we'll have episodes talking about these. And these would be things like lichen sclerosis and lichen planus that can cause a lot of itching amongst, and there's some other things as well, but we'll definitely get into that in other episodes. But there is one thing that can happen in the vulva that's probably, for patients, probably one of the most frustrating things, and that's something called lichen simplex chronicus. You want to talk
Yes.
about that?
So lichen simplex chronicus is when you've been scratching so much. That's the verb to scratch. You've been
Hmm.
scratching so much that the skin has become thickened. And so usually this kind of looks like leathery skin. It tends to happen more on the labia majora, and that skin is more apt to have it. So, and sometimes I'll see it more on one side than the other. Like some people scratch more with their right hand, and you'll see it more on the left side of their body, or vice versa. But sometimes it's both sides where it just has this leathery, thick appearance to it. And then sometimes I'll actually even see areas that will be kind of a little bit whitened, not like lichen sclerosis, but just a little bit pale in color. And they also, if I biopsy them, can come back lichen simplex chronicus. But basically, this is like a basically chronic inflammation from scratching.
The word lichen means thick. Now, in lichen simplex chronicus, it can very much look thick. In some of our other dermatoses, like lichen sclerosus, lichen planus, it doesn't always look thick. That thick, and it comes from how it looks under a microscope to a pathologist if you send that for a biopsy. But, lichen simplex chronicus, it's a chronic itch scratch cycle. And oftentimes we never know what started it. Sometimes we start to treat it, it gets better, and then we realize, underneath there was lichen sclerosus or lichen planus, and that started an itch scratch cycle. And again, this is what I like to say, the layers of the vulva. It's like walls. You knock one down, then another one pops up, and you got to keep going until finally you can get all the walls to stay down.
Yeah.
And I think that's frustrating for a patient sometimes, of like, how did this happen? How can I prevent it? And sometimes we don't know the answer. Would you agree?
True. Yeah. Sometimes we don't know what the instigating thing was. One of the things I ask all my patients that come in with vulvar problems, I was like, finish this sentence for me. Everything was fine until.
Yeah.
Because as I'm playing detective and trying to figure out what went awry here, I want to know what started it all off. Because sometimes people have like an incident that happened, but a lot of times there isn't. So sometimes we just don't know.
Now, the best question for lichen simplex chronicus, and patients, I think, sometimes look at me like I'm crazy when I ask them this question, and it is, does it feel good to scratch it? Because this is the one that it will feel good to scratch. They will get that relief of like,
Yes.
oh yeah, like I'm getting it. Then they'll have some, resentment that they did it because it can hurt or it can bleed. And the level of scratching that happens for this type of problem, I've seen extremes of toothbrushes. I've seen steel wool. The itch is so bad, and you can go to extremes to scratch it.
Yep. I've seen a patient with a hairbrush. She said she uses a hairbrush to scratch.
Yeah.
So yes. I thought the question you were going to ask, the $1 million question, was, do you scratch when you sleep? Because patients always look at me kind of funny, because you don't really know if you scratch when you sleep. But if you wake up more itchy than you did before you went to bed, maybe that you're scratching when you sleep and you don't even know it. So I often, if they have a partner that sleeps in the bed with them, ask them, do you feel like they see you scratching in the middle of the night, that kind of thing. Because, as we think about how inflammation causes a lot of this itchiness, the symptom, if you're scratching all night, then basically you're inflaming those tissues all night. And then all day you're dealing with that inflammation that can make it itchy during the day too.
I'll even ask them, in addition to, you scratch at night, but does it get worse at the end of the day? And they're like, how did you know that? And I think it's because so many people, you're going through your day and you're busy and you're not thinking about things. Then you get home and things start calming down. And you're like, oh my God, there's still that itch there and I need to scratch it. So that's another thing that we'll see a lot of.
Hello, and welcome to Ovary Active. I'm Dr. Rebecca Dunsmore-Sue.
And I'm Dr. Amy Vodish, and we are your expert guides on the strange and often uncomfortable journey that is perimenopause.
Most of you are familiar with the term menopause, but as doctors of gynecology, we see a lot of patients who are bewildered by what their bodies are doing. Wonky periods, mood swings, sleeplessness, heart palpitations, hot flashes, anxiety.
But because they're told they're too young for menopause, these patients don't realize the changes they're going through are hormonal.
Perimenopause is the time before menopause when hormones start fluctuating. It can begin as early as your mid-30s, and to put it bluntly, it can suck.
Fortunately, there are ways to alleviate many symptoms of perimenopause. Bonus, the sooner you recognize perimenopause,
The sooner you can act to preserve your future health, and that's why we're here.
to help you understand what's happening, what you might expect next, and how to get through the next few years, sanity intact.
Join us right here on the second and fourth Thursday of every month for a new episode. That, at least, can be regular.
Find us wherever you listen to podcasts and share with others who could benefit from the information.
Perimenopause doesn't have to be miserable, period.
I see what you did there.
Did you like that? I thought it was funny.
I can't say enough that if you're having an itchy vulva, you need to go in and get an exam to figure out if there is a dermatoses there. So these are the lichens. Lichenification, like Meredith said, is like this thickness. And these different types of lichen can have different treatments and mean different things for long-term symptom control and things like that.
Yeah. And typically with this lichen simplex chronicus, with the itch scratch cycle, again, not medical advice, but typically when we diagnose this, we will treat it with topical steroids and calm the inflammation down. But so many, we also have to address the urge to itch centrally in their brain, and using medicines even by mouth to kind of calm that down, that be it they're sedating or they kind of reduce anxiety, because the only thing that will make this go away is you got to stop scratching it.
Right.
It's the only thing that will make it go away. So we will do everything we can to help the skin, but we also have to decrease the urge to scratch.
Sometimes we'll even give medications to help at night to calm down that desire to do that. And one of our attendings in residency always would say, wear cuticle gloves. Remember that? So that you can't scratch. I tell them, I usually don't use cuticle gloves, but mittens.
Yeah.
Some things you can't get in there and really scratch. And one thing we should say when we use the term lichen or lichenification is that, we think about moths growing on trees and things like that. There's no mold growing on your vulva if you have one of these conditions. Nothing. It's really just, as Meredith mentioned, it's like a thickening, and it can be a scarring in some cases too.
We've been talking about dermatologic things. Next thing we'll move on to is what most people gravitate to when there's an itch in your vulva, and that's an infection. So what kind of infections can we see?
Right. I mean, the first thing that's going to come to mind is yeast. Patients come in, any kind of itching. In fact, honestly, most of my vulva patients who have any kind of vulvar concern, I do a yeast swab. I swab and look underneath the microscope to look for fungus, so I can see yeast buds or yeast hyphae under the microscope in my office, which is always, as a microbiology geek, really exciting.
Yeah, which kind of look like tree branches and almost like little berries. I would describe that.
Yeah.
And Ashley is a microbiologist, and so she really enjoys this stuff.
I do. I love my microscope. I also just think it's nice for patients to know while they're there and not wait 2-3 days for a test to come back. But definitely also swab and send off tests to see if there's yeast. And so yeast or candida is one of our most common things that will cause itching. There's different types of yeast. The Candida albicans, that's the microbiological term for it, is the most common type of yeast that grows on the vulva. But there are more rare yeast that we as vulvar specialists see actually fairly frequently, like Candida glabrata and some other ones. But generally, Candida albicans is the most common one. And some of the symptoms you'll see with this is itching, but also usually that cottage cheese discharge, that feeling like you want to put your hand inside your vagina and scratch it. Those are like your common yeast infection symptoms.
And yeast can be in the vagina, but it also can be on the vulva. It can happen to people because of they're just kind of genetically predisposed to being someone who gets a yeast infection semi-frequently. It can be some medical condition. So sometimes we even have to kind of look even bigger picture beyond, like maybe do you have diabetes?
Sure.
There's definitely even some medicines that people can take now for diabetes or for... I have a patient who had a heart attack at a very young age, and she came in with the worst yeast infection I've ever seen on her vulva, and she was taking one of these medicines, and what these medicines do is essentially they make you urinate glucose out of your body, and that glucose or sugar that goes all over your vulva is just like food for yeast. I'm rather terrifying that the commercial for one of these meds is a woman dancing in the streets about how much she loves her medicine, and I'm like, she's dancing because she has a raging yeast infection on her vulva.
It's true. It's true. I mean, yeah, those medicines definitely can increase that risk. The other thing I always think it's important to say is that you can have yeast infection in your vagina and your vulva, or you can have it mostly in the vagina, or you're going to have it just on your vulva. I've seen a skin infection, not, in the vagina. I think we always think about yeast being in the vagina, but I've had patients who've come to me who've had itching for 5 years, and no one has ever swabbed their vulva to look for yeast. And I look at their vulva and I think this has to be yeast, and I treat it and they get better. And it's usually positive. So it's one of my big things. Like, I think as gynecologists, we were taught swab in the vagina, but if the problem's only on the vulva, please swab the vulva.
Yeah. Amen. And a yeast infection on the vulva can look very characteristic. It can be very swollen. The skin is almost like translucent and pinky purple. And you can have tears, like little tiny tears. And it's really painful.
Yes.
In addition to itching. So that's kind of what it can look like.
Yes, absolutely. What other infectious reasons would we get itch?
A lot of patients like to always think of bacterial vaginosis, but I think it's important to note that has vaginosis in the name. So BV will not happen on your vulva.
Exactly.
And BV is more of a vaginal discharge that can smell. We typically say it smells like fish. It can be irritating in the vagina. You can have some pain and maybe some like urinary symptoms, things like that, irritation, but it is not going to be on your vulva. So that is not something we look for in an itch on the vulva.
Yeah. I mean, bacterial vaginosis is, like Meredith says, in the vagina. It's usually like that thin white discharge. I always think it's not a vaginitis, so there's not as much inflammation. So I don't generally associate itch with it, but some people can be irritated by the discharge. But definitely odor and thin discharges are some of the main diagnostic criteria for BV.
So we've talked about some bacteria and a fungus. Now let's move to some viruses. What kind of viruses can we find on the vulva?
Right. So herpes, super common infection in our society. People are always super embarrassed about it because it is a lifelong infection. I try to reduce that stigma because there's a pretty high percentage of people who have herpes in this country. Most people have been exposed at least to type 1 herpes, which is the oral herpes on the lips. But definitely I think 20-30% of patients will have had type 2 herpes also. So that's where you can get little sores on the vulva. And you can get them on the labia majora, labia minora. You can get them in the vagina, but for the most part, we see them on the labia minora and on the general vulva. But they are painful ulcers. They often, there's a prodromal thing that happens with herpes where before you get the ulcer, you'll get itch. And that's sometimes a sign that you're going to get one of these outbreaks because it is recurrent. Herpes virus lives in the nerve endings. It's there forever. Despite a lot of science that's gone into this, we do not have a cure for herpes, but it does live there forever. And when your immune system is busy fighting off something else, or you're under a lot of stress, or the immune system is not able to fight this off, that's when you get an outbreak.
Yeah. And so leading up to it, we mentioned the prodrome. There's a lot of people these are the symptoms or feelings that you get right before you were to see the ulcers, where you might start to get a little tingle or an itch in the vulva. And that could be a sign of that happening. So, and then there's another virus that's extremely common that can be in the vulva, and that's the human papillomavirus, or HPV.
Also super common. For a lot of people, it will be asymptomatic. There is over 100 different types of HPV. Most of them don't do a whole lot, but some of them are high-risk HPV. And the high-risk HPV can cause abnormal cells on your cervix. So there's that. That is usually asymptomatic, although we can see it on your cervix. You don't feel itch or anything on the cervix generally. But if you get genital warts, which are two of the lower risk types of HPV, those sometimes can be itchy, especially as they're growing and are present on the vulva.
They're very obvious to see on the vulva, and they can be diagnosed. And even you can see them if you're looking to where your itch is. And if you notice these little bumps that almost have like little fronds to them a little bit, they're kind of, some people call almost like cauliflower, like the papilloma of human papillomavirus is kind of referring to this kind of appearance that they can have.
What I tell my patients is that pretty much 80-90% of women get exposed to HPV at some point in their lifetimes. You can get HPV just from one sexual partner. You don't even have to have penetrative sex to get HPV. There are studies that show that you can get underneath your fingernail. So just even hand the genital touching can transmit HPV. So again, I'm trying to get rid of the stigma. I do want to say that I did overestimate the HSV percentage there. Just going to go back and say that it's really only 12% based on my quick look. That seems really low to me. I mean, I still think that there is I'm not going to dispute this data, but I do think that it is a pretty common infection that people have.
Yeah. And the technical term for for genital warts is condyloma acuminatum.
Yes.
And that is because they're acuminate, that's the fancy word for kind of how they look.
What other less common things can cause itch?
Going a level deeper, which again, the layers of the vulva, you got to knock those walls down. So say maybe you've been living with a chronic condition, a pain, infection even in your vulva. We get all that better. Or maybe you didn't have any of those conditions, but you have itch in your vulva and everything looks totally normal. So you could have both of these scenarios can exist, but you've got to think even a level deeper. And we have nerves and muscles of the pelvic floor that actually can cause itch. And some people find it hard to believe that nerves and muscles can cause itch, but they absolutely can. I mean, imagine if you did 1,000 squats and what your glute muscles will feel like after you do that. I mean, it can kind of feel itching and burning and that like on your skin. And the pelvic floor can do that for sure to your vulva. And male or female genitals can have itching and burning that can be from tight pelvic floor muscles or even nerve insults, injuries.
Absolutely. I'm sure you'll hear me say this a ton on this podcast, but when I'm trying to figure out what's going on with a patient, I'm always thinking, is it the tissues? Is it the muscles? Or is it the nerves? And is it the little nerves in the skin or is it the big nerves from the spine? So these are some of the ways I kind of think as I'm playing detective of what's going on. So, like Meredith said, once we've kind of fixed maybe the inflammatory component of this itch, whether it's an infection or the lichen simplex chronicus, then if it's still there, then sometimes it's because there's tight muscles. The other one that I'm still kind of trying to get a better understanding of is kind of pelvic congestion, or, like kind of getting, varicosities, or basically a backup of blood flow in these areas or in your pelvis that can affect the amount of blood that's in your vulva, and how that can be sometimes itchy. And I definitely think that could potentially contribute. And not a ton of research on that, but it's super interesting to me.
It is something I have to keep adding to my differential too, because it is real. You do see it.
You do. Yeah. One of my PTs in my area is expert on this, so maybe we'll have to have her on. So
love that. But
when we think about all these different things that are going on that can be causing itch, one of the things I like to tell patients is, if you feel itchy, try not to scratch it. If you feel like it's just too much, you can't tolerate it, I think keeping a little tube of the over-the-counter hydrocortisone, the low-dose hydrocortisone, in your bathroom. Try to get the ointment. If you go to the aisle, the steroid aisle in the drugstore, there's all these hydrocortisone creams, but we usually like to use ointment on the vulva. It sticks better, it absorbs better, and it's more soothing. Doesn't also usually have some of the alcohols and things that irritants that can bother the vulva. But having that 1% hydrocortisone that's just over the counter in your bathroom, and if you have an itch that you just feel like is not going away, you could use that intermittently to see if you can calm it down. And my other thing I really like is ice. Don't put ice right on your vulva. Ouch. But if you take like a bag of peas from the freezer, put a towel over it, put on your vulva, it actually really can calm down some of the inflammation that's causing the itch.
Yeah. Another thing, shout out to all barriers and moisturizers. They actually can be used, and there is actual vulva moisturizers you can buy over the counter. A barrier, when we're talking about that, this is, I think, the adage in dermatology. Granted, we aren't dermatologists, but I know I was always taught, they always say, if it's dry, make it wet. If it's wet, make it dry. So if it's more of a dry thing, you can use like what they would refer to as like an emollient, which would be something kind of more greasy, if you will. Things like Aquaphor, Vaseline even is fine. There's CeraVe makes some products that like a healing ointment. Again, you mentioned ointments. And then if you're someone who it's more wet there, if it's sweat, if it's urine leakage, things like that, you want to kind of keep it dry. And things like Boudreaux's butt paste and Desitin that you use on your babies. It is actually safe to use also on our vulva, pending if you don't have any allergies to some of the chemicals in them or products, things like zinc oxide and things like that, based products that can really keep moisture away from your skin. I tell my patients it's like sunscreen for your vulva. It's like there's no sun that shines down there. It's just keeping all the elements away from your vulvar skin. And that can be something that's soothing, but also protective if you have certain scenarios where you get irritated from the elements, as it were.
Yeah, I think that's perfect. So, I think it's fine to try some of these things. Again, this is not medical advice. If you're having vulvar itch that's not improving or is going on and on, you should go see someone. And they should look at your vulva, and they should help you determine what the next steps are. Thanks for joining us for this episode of Labia Logic.
We get it. Sharing a podcast like this might feel a little taboo, but we're here to break down those barriers. Labia Logic's all about empowerment, not embarrassment.
If you found this episode helpful, we hope you share it with others who could use a little labia logic in their lives. Can't we all? You can find us on all major podcast platforms and connect with us on Instagram at labia_logic.
From our lips to yours,
Viva la vulva!